Hello, Claire. It's Tulio. Just to give you a quick response on your post. Great post, by the way. You mentioned quite a few things that I also wanted to mention on my post if I didn't. When it comes down to the cost, fraud, and abuse of the healthcare system in the U.S. You mentioned that per capita, the U.S. pays more on healthcare than any other nation. Yet we're sort of at the back of the pack in providing quality healthcare. So our healthcare is not efficient, and it's really a waste. A lot of money wasted on doctors, policies, systems that are not providing the care they're supposed to be, and there's too many doctors and agencies out there that are trying to take advantage of the Medicare provided by the government. You mentioned that some of the things that the policy is really trying to aim at, trying to get everybody insured. That's the first thing, and not only that, but providing an insurance that's efficient for them, it's equity for everybody, and it's affordable. That's what it comes down to. The government cannot afford it, and individuals cannot afford it, and that those that do is not a large amount of people that can afford it. And if they do, it's taking a lot of money out of their pocket where it can be provided for their families. You also mentioned the fines. Yep, I also read that from the on the Money webpage. There's going to be fines for individuals that do not meet the minimum health care provided. But some good things about the provisions are that it should be affordable to everybody through the subsidies that the government is going to provide. So they're going to provide those subsidies to states, to companies, large and small, and to individuals, through tax breaks also. So the bottom line is that it should be an affordable health care for everybody, but that's yet to be seen on the long run as far as efficiency. Some things that you mentioned that I agree with, probably putting a cap on spending. That would alert medical agencies and doctors to not overcharge, just like some of the examples that you mentioned. Overcharging for simple care, simple items that wouldn't cost that much normally. Also charging for unnecessary care. Agencies are fraudulently charging the government for care that was not provided. I think that's the biggest problem right now. If the government can take care of that and at the same time reduce costs, then I think the system will work. In a lot of countries, I lived in Germany for about 17 years, and I saw that their healthcare system works very well, and you're not taxing a lot of people out of their pocket. They do pay up front though when they get their paycheck. All that goes to the government, and then the government kind of controls the costs, just like you mentioned, the caps, and across the board, across the whole nation. So a couple of things that the provision also does, I think that's good. It expands Medicaid to everybody, so everybody can afford. There's some individuals that just make a little too much, or not a little too much, but a little over what the percentage is from the poverty level, that do not qualify for Medicare or Medicaid. So it covers them now. Also, some of the things are the essential services and preventive care that are covered under the provisions. So I liked your post. I like some of the things you cover, and you hit it right on the spot. I think healthcare costs, the frauds from the different agencies and the doctors is really raising the costs for the government and for individuals. If we can fix that, provide a good healthcare that's affordable for everybody, then I think we're on the right path. Alright, out.